call.
Oh.
Okay. So, yeah.
Yeah.
From your vaccine?
No.
Oh.
I was in the principal's office crying, so that's all I'll say about it. It's all good.
Been there.
Yeah.
Hi all. Oh, we got 27 participants. Hello everyone. All right. Does it look like, are we set up? We good to go? Oh, we got people are rolling in. Hello, welcome. Wow.
Hi all. Welcome, Ben.
Yeah, sweet. This is so fun. This is exciting.
Just wait.
All right, we'll wait for a few minutes to let everyone pop in. Looks like we're at 40 now. We'll just wait for a couple minutes. We can hang out, chill, and see who all shows up.
Sure.
People out there in the audience, if you have questions, comments, concerns, want us to stop, explain something more, disagree, agree, whatever it is, you can hit us up in this Q&A. Oh, smoke break.
Yeah, Ben.
Yeah, we'll get a little smoke break. Pull out your pipes. This is going to be a fun one. And so there's the chat and the Q&A, and because I'm sharing my screen, I'm probably just not gonna. Can y'all see my question and answered panel being open right now, or does it?
I can actually control it myself, man, too.
Beautiful. All right.
But it gets in the way of the screen, so.
Okay, 12:01. We have 44 people on. This is awesome.
Oh, Heidi, your mom's here, April.
Family affair. Here we go.
Our fearless leader. Cannabis care team. Heidi.
All right, so wait. This thing says 12:02, and then we'll kick this thing off.
Sure. 46 people.
That's super cool. This is awesome. All right, 12:02. Anyone else popping on can just catch up. Do y'all think we're good to move forward, panelists?
I think so. We had a time constraint, so
Yep.
let's make it happen.
All right, let's do it. Is Eric on here?
I am here, man. I'm here at the sunny Arizona. Had to take off out of the Kansas City. The temperatures were dipping, and so got a little bit of work down here. A little bit of
Smart. Well, let's get this thing going. Well, welcome to the Combo Elevate Holistics Cannabis Care Team Verdant Health webinar on sexual wellness and cannabis. Today, we're going to look at the importance of sex, some products to help out, really cover a wide variety of topics, and really hope to add some insight and answer some questions that people might have. And as we're going through this, if there's stuff that people have questions on, comments, concerns, as I said, just shoot us over a question in the chat, and we will be able to get to it. So the format, we have 3 speakers. Lyra Healthcare is going to speak for just a second on their new product coming out for those around Pennsylvania, and then in any other markets that I guess they're in technically. And then the Hemp House is nice enough to give everyone in attendance some samples, and so they're going to talk about what they're doing on the thank you screen. So let's dive right in. Everyone's going to get to know the stories of the panelists involved and who Elevate Holistics is. We're the ones who are kind of putting this on. So if anybody needs medical cards, certifications, has questions about how to use cannabis, do they qualify for cannabis cards, wherever they are, Elevate Holistics, we can certainly help get them certified all from home. Everything we do is online. And then April and Jennie as well can answer any healthcare driven questions that you might have. So let's get it going. Thank you all. Boom. So here we have our first panel. Dr. Jennie Bronenborg is going to be the first to just kind of tell us their story, and then April, and then Matt, and then we're going to get to the thank you slide, and from there we'll really dive into the content.
Thanks, Stephen. So I'm Dr. Baublitz-Bronenborg. I am a physical medicine and rehabilitation physician, subspecialty board certified in pain management. Stephen has asked us to describe how we became involved in the medical cannabis field. I will say that I hail from a background in pain management, interventionally trained to provide spinal injections for chronic neck and back pain. And I practiced in that field for about 10 to 15 years, delivering those types of modalities for patients with chronic spinal pain. I got to a point in my career where I felt somewhat trapped in that if injections were ineffective for patients, I really had no other options other than opioids, which, as we know, are a huge dilemma and crisis in our society. And the other piece to it was I was not sure after 10 to 15 years of administering corticosteroids repetitively, I was not sure that I was really doing my patients any favors long-term. So I began to research cannabis as medicine, and that's really what started my journey in this field, or at least incorporating this type of medical therapy into my practice. Turn it over to April.
All right, thank you, Jennie. So again, my name is April Hatch. I have been a registered nurse for about 16 years, and it wasn't too long after I got into nursing that I felt like I wasn't really able to help people. That is why I went into nursing, and just in the hospital system and the acute care system, we were just getting patients well enough to get them out the door. We weren't really improving their lives, and that's what I wanted to do. So it was about 6 years ago that one of my children needed medical cannabis after traditional treatment had failed them, and just saw how miraculous of a plant it could be, and have been started working with hospice patients, Parkinson's patients, oftentimes just with CBD. And really for probably the last 2 years have been, working as cannabis care team, seeing patients now by telehealth since COVID. And Matt and I have developed a really solid dispensary training program. We think that education is so important to the success of patients, and we want to make sure that the people that the patients are coming in contact with have the information to give them. So, we work a lot with patients on developing treatment plans, talking about different delivery methods, dosing, and we're really proud of what we're doing. And I think Matt would probably agree with me that for the first time being a registered nurse, I actually feel like I'm doing what I was set out to do, and that's help people. So, and that's a little bit about what we do at Cannabis Care Team. I am fortunately teaching in the Cannabis Science and Operations program at St. Louis University. I think they're going to be launching another program soon. So it's very exciting to be a part of an accredited program that's receiving federal money. And I think that we'll continue to see more of those programs available. So it's been a wonderful opportunity to do that as well. And I'll shoot it over to you, Matt.
Well, I don't know what else to say after that awesomeness that you just presented, but yeah, it's an honor to get to work with you. And like you said, as a nurse, there's so many things out of our control in the hospital system. And even though we know we touch someone's life, we don't get a chance to make a difference as much. And being able to work with you and go out and do these patient educations and dispensary training, watching these bud tenders, these little lights that come on when we're talking to them about stuff, it's such a great feeling, because education is such an important thing to me. And I got into the cannabis industry when I was working in a level 1 trauma center. I was working part-time. I started with the founders of a company in 2014 called Canaway. And when I started studying CBD, a whole education process prompted me to just keep moving forward. And like April, I believe cannabis is such an individualized thing that everybody should have some sort of a personal care plan for them so they can be successful not waste their time, their money, and achieve the goals that they're really working on with their cannabinoid therapy. So I'm happy to be here. It's going to be a really cool webinar, you guys. Thanks everybody for showing up. We appreciate you.
Yes, we do. All right. And a good special thanks to Lyra and Hempos here. So I want to promote Lyra's new brand coming out. So Marissa, if you could tell us a little about that and Apothecarium and everything y'all have going on in the Northeast.
Yeah, thank you for having me. My name is Marissa Liuvi. I'm the Director of Dispensary Engagement for Terrasem, which is the umbrella org, or Lyra in PA. I'm excited to tell you about a limited time product we have, which is called Excite. It's a vape cartridge by Kind Tree Cannabis, available only in PA right now. We tried to make a thoughtful blend of strains with a cannabinoid ratio of 10:1 THC to CBD, with driving terpenes of linalool and myrcene to help promote relaxation without causing sleepiness. We really made this blend with the intention to help someone gain relaxation and control symptoms of anxiety, specifically when entering a sexual experience. So if you visit one of our Apothecarium locations or any PA medical marijuana dispensary in the state, you can get yours today. And if you have any questions on the Excite blend or really any Lyra products, feel free to shoot them in the Q&A chat and I'll get that answer for you. Thanks for having me.
I love that. Absolutely. And then team, are we covering anything about the terpenes? I know she, the 10:1 CBD THC, why that's important, I'm sure we'll get into, but also the variety of terpenes. Are we discussing some of that? Beautiful. Beautiful. Eric, give us tell the people what they can get for stopping in today from the
Yeah. So for stopping in today, we're master distributors for Ananda Hemp, and Ananda Hemp has their Ananda Bliss. It's an intimate oil designed by Dr. Alex Capano. She was rated by Marie Claire in the top 15 most influential women in cannabis of 2019. And she does all of her research at Thomas Jefferson University, but they've come up with a proprietary blend of full spectrum extract, some cacao butter, peppermint extract, and a few other proprietary mixtures for quite an amazing intimate experience. It really increases sensitivity, and it's designed for a woman in mind. If you think about all the people that are making lubricants on the marketplace, it's dominated by more than 97% men ownership in the marketplace. So with a woman making sure it's done right and a doctor, it really, really does well. So if anyone wants their free sample packet, and then we're also going to throw in an Ananda Hemp 2-packet soft gels, works great for pain and especially for staying asleep at night. You can email support@thehemphaus, that's THEHEMPHAUS.com, or you can give us a call at 816-200-2902, and we can mail out your sample packets from us today.
And you said that was, I'm going to put this in the chat, support at
thehemphaus.com. And the other great thing is it tastes like an Andes mint, so it is edible as well.
There we have it. I love that. All right. So will the Lyra products ever be available in Missouri? And I guess better question is outside of PA, Marissa?
So right now we are in New Jersey. We're gearing up for Maryland, but nothing beyond that. But certainly we're trying to get in as many states as possible. And our Apothecarium brand specifically is in the West Coast in San Francisco and Las Vegas. So we'll get there. We'll get to the middle.
Yes. Yeah. That's amazing. And for all the people around Missouri, give it another couple months and you will see products like this hitting the stores as soon as the bulk of the cultivators and the manufacturers are up and running. There'll be some really exciting products coming out. Missouri is set to be a great market. Okay, so thank you both so much for coming on and sharing the love. So let's roll on. Dr. JCBB. You're first, right? Did I mess up the order here?
No, I'm first, yes.
Okay.
So as I mentioned, I'm a physical medicine and rehabilitation specialist. And one of the questions I often get is, what is that? We are the doctors who are really charged with taking care of patients, oftentimes after an acute injury or illness, and really getting them back to that prior level of function that they enjoyed prior to that event. So as you can imagine, along that rehabilitation spectrum of returning to that prior level of function, sexual health, or the return to prior level of sexual health, is often something that needs to be addressed. So the first slide is, what is sexual health? So sexual health was defined in 2002 by the World Health Organization as a state of physical, emotional, mental, and social well-being in relation to sexuality. And it's not merely the absence of disease, but really the presence of that state of well-being. It requires a positive and respectful approach. Oh, sorry, can you slip back?
Oh.
Yep. It requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. And that is really the definition that's most widely used today. So now we can go to the next slide.
Looks like someone raised their hand. I don't know, can we actually, I don't even really know what to do about that, truly. Allow to talk. LaTanya, raise your hand. Let's see what we got. Type it in the chat.
Okay. In 2006, the World Health Organization expanded that definition. Can we go to, to a state of well-being in relation to sexuality across the lifespan. So really it's a broad reaching lifespan. And they added a spiritual dimension. Can we get back? Yeah. And they defined it as an intrinsic element of human health. So now we can get to the next slide. So why does sexual health matter? So the benefits of sexual activity have been broadly studied across varied aspects of human health. And these slides are not meant to be comprehensive, but we just like to touch upon several aspects of health and organ systems for which sex has been found to be beneficial. And the first is, what does sex do to our stress response? So now more than ever, we as humans are faced with intense levels of stress. And how we deal with stress really can impact our overall health. And sexual activity has been shown to have a stress reducing effect. So in this study in 2019, they studied the effect that intimacy with a partner had on cortisol levels. And cortisol is a hormone that's released in response to stress. And they found that intimacy actually helped return cortisol levels back down to normal range. After a stressful stimulation, intimacy helped return those levels within normal for both men and female patients. Sex triggers the release of chemicals in our body, quote, feel-good hormones, oxytocin, endorphins, and we feel that these hormones are really responsible for stress reducing effect. And then we can go to the next slide. These same hormones have been shown to have a positive effect on sleep. And the importance of sleep cannot be overstated. So there seems to be a release of these feel-good hormones, including prolactin, which circulates following orgasm, and an overall stress-reducing effect, onset of relaxation, feelings of satisfaction, and eventual induction of sleep. So then we can go to the next slide. So a big question, and one that will continue to be studied, is how does sexual activity affect cardiovascular health? There have been some conflicting studies on this, and again, this is not meant to be comprehensive, but prior studies have suggested that modest sexual activity twice weekly for men conferred a protective effect for men on future cardiovascular events. This study in 2016 actually did not show that. This study looked at partnered sexual activity and found a high frequency of partnered sex in women actually conferred a protective effect, but they did not see similar effects in men. So this will have to be further studied. And again, a lot of things that go into this, particularly with the heart. So we can go to the next slide. What has been demonstrated for men is that a high frequency of ejaculation has been shown to reduce prostate cancer risk. This study in 2004 looked at almost 30,000 men, and they found that men having 21 or more ejaculations a month compared to those not, compared to those only having approximately 4 to 7 per month. Men having those 21 or more ejaculations per month were found to have a decreased risk for prostate cancer. And they actually extended this study out for 10 years, and those results carried through over 10 years. And then we can go to the next slide. So the question is sex as exercise. Maybe, maybe not. The general consensus is that if you can exercise hard enough to work up a light sweat, you're generally safe to have sex. A big concern for people is, what is the risk of dying during sexual activity in terms of a sudden cardiac event? That risk is actually very low, 0.6% to 1.7%, although it does seem to affect men more than women. But that risk is low, and generally, if you can exercise, you can be safe for sex. We always recommend any patients who have a history of any cardiovascular events, heart failure, any cardiac procedures, obviously they get clearance from their cardiologist with regard to what level of activity is safe for them. But in general, sexual activity really is felt to be comparable to climbing about 2 flights of steps. And we look at what we call metabolic equivalence of activity, and really it's a clinical measure of physical exertion. Really, during orgasm, you reach about 3 to 4 mets, which is, a slow walk. So maybe exercise, maybe if you're not exercising at all, it's better than doing nothing, but it's not really great exercise.
Heard it here first.
Yeah.
Bring it into the regimen.
Next slide. For women, urinary incontinence affects up to about 30% of women at some point in their lives. And we all know that's a huge problem. The adult diaper industry is massive. So how can sex help with that? Well, most of us have heard of Kegel exercises for strengthening the pelvic floor for women. This is a physical modality that's felt to help with stress incontinence. When Dr. Kegel was studying this technique back in the 40s, several of his female patients reported enhanced sensations in their genitals and a greater ability to experience orgasm performing Kegel exercises. Pelvic floor strength was found to be higher in women who were having orgasms than those not. So that strengthening effect may be beneficial. Having that pelvic floor activity may go hand in hand and may ultimately help with urinary incontinence for women. And the next slide. So last slide on potential benefits of sex would be our immune system. So there's been some suggestion that sex can help our immune system. This is a study in 2004 that looked at college students. And they divided the students into 4 categories according to the frequency of their sexual encounters. First category, students having no sex. Second, less than once a week. Frequent categories 1 to 2 times a week, and very frequent was 3 to 4 times a week. And then they collected saliva samples and tested for the IgA levels in the saliva. And IgA is an antibody protein in our bodies, which helps fight infection. And what they found that were students having sex in the frequent group, which was 1 to 2 times a week, actually showed higher levels of IgA than the other groups. Now, why 1 to 2 times per week versus the 3 to 4 times a week? That was not demonstrated in terms of why that was, but there was no relationship to the level of sexual satisfaction or the length of the relationship. So it was just the pure having sex 1 to 2 times a week. So that is a broad summary of different ways sex can be beneficial to our overall health. And then I believe in the next slide, April will jumpstart off into cannabis specifically with regard to sexual health.
Yes, thank
Yeah,
you.
and if anybody has specific questions or comments about the content as we go through, just park those in the Q&A and we'll make sure to get to everybody at the end.
All right, so I'm really going to talk about the specific research we have on how cannabis affects sexual wellness and sexual health. And when I started to do that, I wanted to find the numbers of people who were reporting some sort of sexual dysfunction. As we're all aware, it's often a difficult topic to talk about with our physicians. It's very difficult to talk about with our partners or friends. And so people have a tendency to keep it in. And, you know, I was really disappointed that the most recent research I could find was from 2000. And that study by Rosen, they actually found that so 43% of women, 31% of men are suffering some kind of sexual dysfunction. And in that study, they pointed out those could be psychological issues, chronic pain, erectile dysfunction. There were a wide variety of reasons why people were reporting sexual dysfunction. So as we can see from what Dr. JCBB just said, it's important. So we need to figure out how we can help people overcome sexual dysfunction. So if we want to go on to the next slide. All right, so does cannabis promote sexual health? There was a study that I'll talk about in the next slide that really I found was interesting. So here it is. So in 2011, Baggio did a study and they found that in states where they had recently passed medical cannabis laws, that people in those states were having more sex and more babies. And I thought this was interesting. I think that there's definitely a wide variety of reasons why that could have happened. But they, searched and they looked really over 30,000 people. So that's a big number, especially when it involves cannabis science. So not only were they finding that people in legal states were having more sex, but yeah, they were having more babies, and they couldn't really hypothesize why this was, but they thought that potentially because people were consuming cannabis, they may not have been as concerned about contraceptive use and really more focused on the immediate hedonic effects and, the intimacy that was occurring, because as we know, cannabis has a tendency to bring us into our current state of mind and help us forget about some of those other things. So yeah, that was the first study that got me excited about this topic. And you can go to the next slide, Stephen. And I've been working with patients for a while, and I knew that patients who are experiencing pain, anxiety, depression, patients who there's any condition that affects your health is going to affect your sexual health as well. So, there was a study in 2018 that actually looked at the effects of both alcohol and cannabis. When I went to nursing school 15 years ago, there was some science that we discussed that actually said small amounts of alcohol could improve sexual health. Well, we know that that's just not true from the studies now. With alcohol, it unfortunately has a lot of negative effects when it comes to sex. And then, they found when they did that study that cannabis heightened sensory perception, which if you're a consumer, you probably are aware of that, increased relaxation. Oftentimes patients just need something, or people need something to turn off all of those other factors, all of those other things that we're thinking about, kind of turn off that to-do list and allow ourselves to be in the moment and want to connect with other people. You can go ahead and go to the next slide, Stephen. So this was a really interesting study that actually was published in 2017. And so what they did is they studied the anandamide levels and the other endocannabinoid levels after patients masturbated to climax. And what they found was that anandamide, which is also known as the bliss molecule, which is a very important part of the endocannabinoid system, was more present, as well as 2-HG. So if you're on this webinar and you're not too familiar with the endocannabinoid system, I strongly encourage you to go out and read more about it. But the endocannabinoid system is really the system that communicates with all of our organ systems and really controls how we relax, eat, sleep, and protect and forget. So it's a very important system. It is responsible for maintaining homeostasis and balance in our bodies. And those endocannabinoids, anandamide and 2-HG, are the most commonly studied and the ones we have the most information about. But I just, it's very interesting that those levels were higher in people who had just masturbated. And so I think that doesn't necessarily leave us with any conclusions, but it does allow us to possibly understand how the endocannabinoid system, or how endocannabinoids can affect sexual wellness. So there is definitely more research that needs to be done. Go to the next slide.
And with this, April, we're basically consuming things like CBD and THC, the phytocannabinoids would help regulate this and augment if our levels are low or whatever that might be. That's kind of the conclusion.
Yeah, so the reason, so many people today, their endocannabinoid tone is just, it's just not at a healthy level. And there's lots of things that we can do to promote the tone of our endocannabinoid system, help it work more effectively. And we know that phytocannabinoids from the cannabis plant are a big part of that, but there's also so many other things too. Diet, stress reduction, exercise, laughing, playing, they all can play a very important role in just the health of that system. Yeah.
That's beautiful. Laughing. Love that. We all need more of that.
Smiling. Yes. All right. So women, and the reason why I'm using these studies is because for a long time, when they would study cannabis and they would study really anything, is they would basically lump everyone together who used any substances. So that included alcohol, that included other drugs, and cannabis. So they were really looking at how those drugs affected people. And so really just recently in the last few years, are we specifically looking at how cannabis directly affects sex. And this study in 2019 actually looked at women who were, I believe it was over 3,000 women who were utilizing cannabis on a regular basis. And they had overwhelmingly reported that they had an increased sex drive, improvement in orgasm, and decreased pain, as you can see from this slide. In 2020, a study came out that actually showed that
Uh-oh. Did she just get kicked off?
Yeah, it looks like we may have just lost April. Hopefully.
Well, Matt, are you comfortable picking up the torch here?
Well, yeah, I don't know how many other slides she has, but let's give her a second. Is there any questions or anything that we can answer? I know there's one that was wondering about the slides being available for download, and we're not going to really have them available for download, but we are going to have this recorded, and you'll be able to watch it again at another time as well. So I hope that answers. That was for Claire Washington.
Yeah, and looks like, Connie, we are recording it. We will make the recording available. Are there DOI or PMID numbers for the Catherine, Lynn, and Castman? Yes, I think so. Heidi raised her hand. Sexual medicine 192, 197. I don't even really know if that's the right numbers. I'm just out here talking at this point. So DOI or PMID numbers, we can look that up. I'm not sure. Anything else out here? The Peak. I'm not sure the name of the product at the Peak, but if you go in and ask them, there's Oklahoma's a great medical market. They're gonna have products for you everywhere.
April is back, you guys. Awesome. You're back.
I'm back. Sorry about that. Do you want me to continue? I've only got like 2 more slides. Sorry.
Yeah, throw it on. Go ahead.
Okay.
We're answering a couple questions and stuff, so.
All right. So in 2020, they actually did a study where they looked at women and the frequency of their cannabis use and their sexual health. And so they were looking at women who use cannabis, less than 1 time a week, I think 2 to 3 times a week, and then women who were using cannabis 4 to 6 times a week. And the women who were using cannabis 4 to 6 times a week reported those things at the bottom of the slide. So improved sexual health, desire, satisfaction, better orgasms. And so, for so long, we had been, there had been so many studies that said actually cannabis can negatively affect sexual wellness. But with these studies now, we know because they were studying the frequency of cannabis use, just specifically that. So we know from the evidence that we've seen in the last couple of years that it does improve women's sexual wellness. And these aren't only the 2 studies. I think there's currently 347 studies that look at how cannabis affects sexual health. So again, it really all does go back to the endocannabinoid system and what cannabis can do overall for the body. And Stephen, I think I've got 1 more slide for men. Okay, so some of the same authors who did this study for women in 2020 did also a study that included men. And again, they were looking at the frequency of cannabis use and sexual function and sexual wellness in men. So again, and Matt will talk a little bit more about this, but we hear all sorts of research that cannabis has a negative impact on the sexual health of men, and Matt will go into that. But in this particular study, those men actually reported less sexual dysfunction, increased orgasm, and increased satisfaction when they were consuming 4 to 6 times a week. And I think that's it for the latest cannabis science research.
More to come over the next several years, I'm sure.
Absolutely.
Well, hello, everybody. This is a great segue into what I talk about, because, a lot of these studies that we're finding that males are finding some positive effects with cannabis are really people that aren't really heavy smokers and chronic smokers that smoke a lot on a daily basis. And larger doses and chronic use in males could lead to erectile dysfunction, low testosterone levels, low sperm count, and a delayed orgasm. And you can go ahead and go to the next slide. I'm going to touch on each one of these little areas of negativity, if you're a male, that is, or maybe if you have a female involved as well. So erectile dysfunction. In 2010, there was a study done by Smith et al. And basically it included over 4,000 men, but they didn't use a validated sexual function tool. They didn't really take into account if somebody smoked cigarettes or was on blood pressure medications and things like that. So although there could be some validity to this, I feel like, there's so much more research that needs to be done about this. And regarding the endocannabinoid system, the CB1 receptors in our brain, THC, can affect certain parts of the brain connected with erectile tissue in the penis, causing basically an inhibitory response that could worsen symptoms of ED. So with chronic cannabis use, you can see things like that happening. And that was the study, that was just out of an article that I had read by Schmalu and Bell. Really interesting stuff. So once again, more research is needed, but how you're using cannabis and how much you're using it, it has a great effect on your body. You can go to the next one, sir. So low testosterone levels. How many testosterone pill commercials do you see on TV? It's a huge thing with males. So, and there was a study done back in, I don't really have the year up there, but it just shows that low levels of THC can actually increase serum, but larger doses and chronic use will lower it. So once again, all this is coming back to more research needs to be done. And as we're moving forward here, and hopefully there's less restrictions on research and a rescheduling of cannabis from a level 1 class drug, we may see more research in these specific areas that we really need to start doing. Low sperm count. There was a study done in 2019, low levels of THC consumption will help out with the sperm count. It's stimulating your endocannabinoid system, kind of like these two ladies before me had been speaking of. But once again, it's a hot topic, a lot of controversial studies. If you're trying to get pregnant, you may want to abstain if you're having some fertility concerns. So clinical trials, the highest quality study type producing the most reliable results, have not yet been performed and would provide further clarification. So once again, we're at that point where we know that lower levels could help out. Chronic use is going to really cause effects that could affect you negatively, especially if you're trying to be getting pregnant with your partner. So something to think about for sure. Next slide, my friend. And delayed orgasm is another one too. And there was an Australian study in 2010, and it found that males aged 16 to 64 who were daily users versus non-users were associated with an increase, and they just reported difficulty having an orgasm. So once again, a small amount of THC could help out somebody maybe with premature ejaculation. That will help delay that a little bit, but larger doses, once again, could start inhibiting that, as well as not having ED, but your ability to achieve orgasm. So what we take away from all this stuff regarding sexual dysfunction in men is we really need more research to be done out there. But, you know, what else could we do? What about CBD? For ED, it could help relax the blood vessels, could decrease our anxiety. A great topical lube with CBD. You want to use a lube because if you're, you know, I mean, sometimes sex is a timing thing, guys. So you may be waiting around for the CBD to kick in if you take it orally. So a lube that you're going to apply right there, that right to your genitals, it's probably going to help out with increasing the circulation. That could be something that you could try. Obviously, evidence from CBD may play a key role in an essential biological process for procreation called the acrosome reaction. And this study found that when the GPR18 receptor in sperm cells is activated, this acrosome reaction is triggered. And this receptor plays a crucial role in the reproductive system as it facilitates the fertilization process. So once again, CBD, it could be the hero that helps out in fertility situations. When you're looking at strains, you're thinking about terpenes, limonene. You know, that's something that's really, you're looking at terpenes that want to help relax you and reduce anxiety and get you in the moment. But you do want to avoid large doses of myrcene that could make you, because myrcene is a terpene with huge sedative effects, and you want to have a pleasurable experience. You don't want to fall asleep while you're doing your thing. So, and then strains, sativas for an energetic partner, indicas for a more laid back experience, 1-to-1 strains, so you're getting the best of both worlds with CBD and THC. And remember, if you're new to cannabis, you always want to start low and go slow. And you can always titrate your dose up, but you want to really start low and go slow. And there's people out there, if you have questions like me and April, and the doctor, if you have some questions about strains and terpenes and things like that, we're more than happy to answer. But the one caveat we could take away from this is we really need more research in human clinical trials to really have some great data for us. And that's my stick.
Sweet. Yeah, I mean, you're talking about the strains and the terpenes and such. April, Matt, what, you know, so we're basically looking at one-to-one strains for some topical lubes might help men. Are there any other products that people should be looking for? I mean, for women, for certain things. I know you all do some of these events with dispensaries. Can we talk about that?
So I think there's a lot of topical options for women as well. There's a significant number of women who have chronic pelvic pain. And so they're finding products that they can insert vaginally that has provided a lot of pain relief in that area. They're starting to combine so many things with cannabis. So they're starting to combine some of those mushroom medications, and then also, ashwagandha, and, they're doing a lot to specifically target, creating intimacy, creating sexual wellness. And it's so individualized, just like everything with cannabis. So just, personally for me, I might need a little bit more myrcene in the evening to, like I said, turn everything off to get me in the mood. Somebody may need something a little bit more stimulating because, they're suffering with chronic fatigue syndrome. So it's very individualized. As Matt was saying, a balance of cannabinoids is really important. And moderation. Absolutely. But it's an exciting market, and there's so many products that we're going to see come out in the next couple of years.
Well, we've got, it looks like we have a few minutes. We've still got about 60 people on. Does anybody have any specific questions that pertain to them, or questions, comments, concerns, myths we can dispel, anything? We got a couple coming in here.
Okay, there's a question. Okay, so I'm so relaxed and tired after sex. I just don't want to get up and do anything. And sometimes this is in the middle of the day, since now my husband works from home. How exciting. Afternoon sex is great. Should I try a few hits of sativa before sex? I think that if sativa is stimulating for that person, then absolutely try a couple hits of sativa. But what your body is doing after sex is it's released all those endorphins, and it's released, those endocannabinoids we're finding. So, that is take advantage of that time, allow your body to utilize those chemicals for healing your immune system. So, maybe kind of being a little bit lazy after that isn't a bad thing.
All right, so we have, I might have just put your email wrong, April. Is it april@thecannabiscareteam.com? Looks like the name is truncated. I'm an RN in Utah, and cannabis has recently been legalized. Medical use as such, patient engagement is virtually non-existent aside from pharmacy bud tenders. What will be my first step aside from educating myself to grow a network of cannabis nurses to fill in the gap? Okay.
Well, one of the things I always tell people when April and I are doing our training is, I always learn stuff from bud tenders, because you can't ever think you know everything, and everybody's perception of something is different, and it could be something that could really spark some real cool knowledge if you open your mind to it. And one of the things that we're not doing bud tender training and talking about compliance and things like that. We're basically trying to give the bud tenders a view of cannabis from the eyes of nurses and how we view it and how it affects the body. So it's been a really cool thing for me in April. It really has.
We really want to arm them with the evidence they need to talk to patients and help patients find that treatment plan. So as we know, there's a ton of anecdotal evidence on cannabis that we've heard. I hear those stories every day. So we really have taken all the scientific evidence and have put it in a presentation, not only verbally, but a book that they get to take home. So they can talk to patients with a variety of conditions about all of the different cannabinoids, about all of the different terpenes. I mean, all that information is there. And then, I think it's so important. Matt and I, we've worked with chronically ill patients for our adult careers, and a lot of people working in dispensaries haven't had that experience. So we want to share, how do you talk to a patient who's really suffering? How do you, engage that person? And, everyone has had lots of positive things to say, but yes, we learn from budtenders as well.
So we had someone ask, and I'm going to butcher this. It's, do the experts know if any studies are happening on cannabis plus vulvodynia?
I have not, unfortunately, and if there were any, it would probably be coming from Canada or Israel or South America. They're really barely touching the surface when it comes to sexual health and cannabis. So I am definitely happy to, if you want to post your email, send any information that I can find along, your way. But that's not anything I've specifically seen in research yet.
Okay, well, this is all I don't see any more questions coming around. We still have 56 people on. Is there anything that y'all want to add? Products to look for? A lot of people are in Oklahoma and Missouri. Are there any dispensaries in Oklahoma that y'all can recommend getting some good products from? I know Missouri, we're just kind of getting out in the market, so it's really hard, and it's too hard to suggest.
Right.
But
well, all the dispensaries we've trained in Oklahoma are really good. So, well, Seed Cannabis, they've been very supportive of us. They really see the value. Yes, they really see the value of working with healthcare professionals and having healthcare professionals available to talk to patients. Punchy Bud is one in Heavener, Oklahoma, if you're in that area. And then I'm trying to think of some other names, but I have read some of the comments, and absolutely there is a wide variety of education among dispensary staff, and we try to get them all informed with the same consistent message they can give to patients. Hemp RX, I have heard of them. Yes, and Dr. Brandon Bailey. Yeah.
I've had multiple conditions with chronic pain due to major auto accident. Wow, that is amazing. Never had as many orgasms as you have now. Starting to use cannabis. That's positive. That's the most positive thing I've heard all day. There we go. I love that.
There's a question.
My partner and I have used CBD lube, but it tends to dry up quickly. Is it because we're doing something wrong, or the product? Maybe augment it with some coconut oil. No, coconut oil is the bee's knees.
I would say, maybe just using the CBD lube kind of in the beginning to increase that circulation and that sensation. And then if you need another form of lubrication, coconut oil, as long as there's no allergies to that, is a good one.
If you were to stop using and experience loss of sex drive, what are other options? Stop using cannabis. Is that, I'm guessing if we were to stop using cannabis and experience a loss of sex drive, what are other options? Well, I'm guessing you pick back up to cannabis. If you can't, then
you can still nourish your endocannabinoid system with so many other things other than cannabis. There's foods, chocolates, cinnamon,
mushrooms.
Well, I don't know about mushrooms. Aren't an endocannabinoid or a terpene.
Not psilocybin, but lion's mane and those.
Yeah. Well, yes, you're right. So there's other things you can do other than cannabis for sure.
Yeah, and you do have to be a little bit careful of lion's mane because it is so good about balancing mood that sometimes you do have a decreased libido because of that. But I know ashwagandha is a really popular one that people are using to increase that libido right now.
Ashwagandha, can you type that out? Send it out to the people.
Mm-hmm.
That is a tough one to grasp. Ashwagandha. Love to see the presentation of university, especially for health aspects. Oh, where's that, Jessica? Ashwagandha. Yeah, I think there's a big miss right now with dispensaries and products where combining herbs and other, I guess, chemicals, if you will, with cannabinoids. And I think you're going to start to see that big time over the next several years. I know in Missouri, Suede already has a food scientist that's looking to combine ashwagandha with CBD and THC. It's going to be a pretty cool. It's a cool market over there, and hopefully Oklahoma and the rest of the nation can pick up on, just how important it is to combine all this good stuff. Is the illicit excite blend available as a tincture? Now, they said it was cartridge only, unfortunately, but I imagine you can find other products out there to with similar terpene profiles to give you similar effects, which would be in an edible or a tincture form. What was the?
I would say finding a tincture with a balance of cannabinoids that is, you find effective if you need pain relief, if you need stimulation, just finding the right tincture doesn't necessarily have to be, focused on cannabis or focused on sexual wellness, but whatever makes you feel the best will make you feel in the mood.
Yeah, and I think the biggest, from an overall health perspective, like the biggest thing I like to stress with patients is just microdosing. Matt touched upon more is not necessarily better with cannabis. I think too, with your cannabinoid profile, there are patients out there with baseline anxiety, which is preventing them from relaxing enough to have sexual intercourse. So for those patients, most of these studies have looked at patients using THC dominant products. We know that THC can be anxiety provoking. So if we do have patients with baseline anxiety and that your cannabis products are not really helping you to relax, you might want to switch up your ratio and go a little more CBD dominant. But I think microdosing, really, even microdosing a high THC product is oftentimes effective for patients to get the desired effect that they're looking for. So I just wanted to add that in at the end.
Beautiful. Well, I think we're wrapping things up. I think we're good to go. So if anybody has any more questions, comments, concerns, feel free to reach out to us, Elevate Holistics. If you need a medical card, come find us, Elevate Holistics. It's elevate-holistics.com. If you want a treatment plan or know anyone around you that needs additional assistance with their cannabis, be sure to reach out to thecannabiscareteam.com. Get in touch with them. Amazing resources. And if you're around the PA, Pennsylvania area, New Jersey, kind of that part of the country, make sure you reach out to Dr. JCBB over at theverdinthealthphysicians.com. Well, thank you all for attending. Thank you so much. And we look forward to hopefully getting some positive feedback from everybody. You can reach out to us at Elevate, just Stephen, STEPHEN at elevate-holistics.com. Thank you all.
Thank you. Bye, everyone.